Hi, I am Dr. Richa Sareen, a senior consultant in pulmonology at Fortis Hospital, Vasant Kunj. I deal with respiratory diseases, asthma and allergies. So today we'll discuss about a peak flow meter. It is a simple, small plastic device that we use for all asthma patients to monitor their lung function at home. It is a very simplified version of the lung function test that we do in hospitals. It is a plastic machine which has gradations and certain zones. It is divided into 3 colored zones: the green zone, the yellow zone and the red zone. One needs to blow into the machine with full force. Peak flow is between 400 to 700 liters per minute for adults. The range varies based on your age, your gender, your height and your weight. Now we come to each of the 3 zones. What does it mean that to be in the green zone? It means that your peak flow is 80 to 100% of your best. It means that your symptoms are under control, you are doing well and you need to continue the medication that you're taking currently. But you need to continue it, you cannot stop the inhaler. Second is the yellow zone. It means that your peak flow lies between 50 to 80% of your best value. This means that you're heading towards an attack and you might be having the initial symptoms of increased cough, increased sputum, breathlessness, little bit of chest tightness. What you need to do is step up your medication, start taking the reliever medication that your doctor has prescribed and be a little more cautious about your symptoms. In case your symptoms increase or persist, then that is the time to meet your doctor. The third is the danger zone, which is the red zone. It means that your lung function is less than 50% of your best. This means that you really need to up your game. Your reliever medication is not going to fully control your symptoms. You might be having chest congestion, chest tightness, a lot of breathlessness, losing out on sleep, and even your oxygen levels can go down. This means that you need to urgently meet with your doctor so that additional medications can be given to control your asthma attack. This is a very simple device wherein we teach the patients how to control and be in charge of their asthma. Please use it diligently.